inadequate or delayed antibiotic therapy. It's a very, very important factor. Patients with respiratory failure and on mechanical ventilation, those who have had a recent hospitalization and age more than 65 years. There are certain important vital signs in the physical examination which are very important. These are fever more than 38 degree, or those patients who are either afebrile or having hypothermia, respiratory rate of more than 30, tachycardia, and significant drop in the systolic and diastolic blood pressure. In the laboratory parameters, it is in fact an indication of multiple organ dysfunction. You look into the renal function, liver functions, and bone marrow functions, and the effect of this sepsis on the coagulation process. So we have various parameters like leukocytosis, leukopenia, the extent of involvement of the lung in terms of whether it is a unilateral disease or it is a bilateral disease, multilobar or a single lobe disease. Presence or absence of bacteremia is an important factor in deciding mortality. Again, the effect on the blood urea nitrogen, sodium, and albumin. The other factors, as I mentioned to you, are the effect on neutrophils, platelets, blood glucose, and history of alcohol. Now this graph very clearly shows the odd ratio of developing mortality of various risk factors, and you can see that a patient who has got renal impairment has the maximum odd ratio of 5 of dying of community-acquired pneumonia than patients who have got dyspnea or congestive heart failure. So you can see here the list of parameters which we have already enumerated, and you can see the individual contribution of each parameter in terms of the odd ratio of causing mortality in these patients. Now subsequently, after we have identified the individual parameters, various bodies, societies and groups have tried to group these various variables in the form of scores to predict not only morbidity, to predict mortality, but also to predict where this patient should be managed regarding the need for ICU admission, the need for mechanical ventilation. So all these factors are clubbed in the form of a score which helps us to triage the patient as far as their management is concerned. The different rules have been published by societies like American Thoracic Society, where they have original and revised criteria, British Thoracic Society criteria, we have pneumonia severity indices. We'll just have try to have a look into these scores and see how they fare in terms of various parameters. As you can see here, this is the original unrevised ATS predicted rules, which has basically major criteria and minor criteria, which again include various factors in terms of clinical parameters, biochemical parameters, the need for mechanical ventilation, need for vasopressors. On the basis of this, morbidity score or mortality score is calculated. Then we have these revised ATS prediction rules, which has two major criteria, that is the need for mechanical ventilation and the presence of septic shock. In the minor criteria, we have systolic blood pressure less than 90, a extensive disease in the form of multilobar involvement, a significant reduction in the oxygenation with a PaO2 FiO2 ratio of less than 250, the presence of confusion, uremia and respiratory rate of more than 30, again indicating multiple organ involvement. On the basis of this, if you have one out of the two major or two out of the three major, then this results into significant mortality. and this parameter has a high specificity and a fairly good sensitivity. The British rules are very commonly used. What we know is curve 65 rule. Now this has a combination of clinical and biochemical parameters. The clinical parameters like presence of confusion, a respiratory rate of more than 30, and a significant drop in the blood pressure. Systolic less than 90 and diastolic less than 60, or a fall of 30 millimeter systolic or 15 millimeter diastolic from the baseline. If we have any of the two, then the mortality increases by 36-fold. It is very important that this score has a very high sensitivity and specificity, and many times clinicians overlook tachypnea and confusion. So these two signs should be very carefully evaluated in all the patients. We also have another score which is called as pneumonia severity index. This is again a model for prediction of mortality. It includes again parameters related to demographics, comorbid illnesses, some parameters related to physical examination, and laboratory parameters. On the basis of this has, as you can see here, the demographics like age, sex, the habitat, in the coexisting conditions like neoplasm, liver disease, heart failure, chronic renal disease, physical exam